Israel reported its first case of Flurona, someone infected with both COVID and the flu. The announcement is sparking concerns over what the combination could mean for infected patients.
And while concerns are growing, Flurona isn't a new combination of viruses. Local health officials say they've already treated patients for both flu and COVID here in Alabama.
With the Flurona, it's basically the combination of the flu virus and the COVID virus. I can tell you we've seen that. It's not that common.
Flu cases and COVID cases have both steadily increased over the past month, and according to Huntsville Hospital, they've already treated patients who've been infected with both viruses.
The ones who get these combined infection have multiple risk factors, and they get exposed to a certain point where they can get both these viruses.
Huntsville Hospital says since the beginning of the pandemic, fewer than 3% of patients had both viruses.
Treatment is going to be the same. You're going to treat the flu virus and the COVID virus at the same time.
The Alabama Department of Public Health says the flu season is already worse than last year, with many people no longer wearing masks or social distancing.
We aren't masking as consistently as we did last year. The memory's not there for last year's flu season. A lot of people have just sort of dropped off the radar.
More flu cases mixed with a 40% COVID positivity rate means what's being dubbed Flurona cases will likely be on the rise.
Imagine that we'll see cases of it. I mean, that's not unbelievable to think that with the numbers that we're seeing with both flu and corona, that at some point we'll see both at the same time.
A combination of viruses, Huntsville Hospital says it's ready to fight.
We're prepared to manage these ones. I wouldn't be too overly concerned about that.
There is still not enough data to tell if being infected with both viruses makes symptoms worse. Huntsville Hospital says from the few cases they've seen so far, that has not been the case.